Focusing mainly on her large toenail today, we will discuss what I can do to help her after 2 failed ingrown toenail surgeries. So stay tuned. Hey everybody, Rachel here, aka the Nail Therapist. Today we're going to look at another failed ingrown toenail surgery. This client came to me after she has had 2, not 1, but 2 ingrown toenail surgeries on this area here. And she still has a lot of pain and inflammation. You can see that her skin is very pink and plump where I am digging my tool around right now. So as part of the video, we'll talk about what I'm doing and also what we plan to do to help relieve the pain in her toenail, hopefully permanently. So we start the pedicure off like a normal pedicure, just kind of assessing the nail and seeing where her pain is, doing the cuticle care, removing any buildup and smoothing the surface of the nail like you see me doing here. And then we'll put her in the foot bath to soften the skin. Let's just talk a little bit about what it takes to do a quote-unquote ingrown toenail surgery. So there are 2 types of surgeries that generally are performed on the toenail. One is called a matrixectomy or a partial matrixectomy, and then the other, or chemical matrixectomy, they're all called something like that. And then the other one is called a wedge resection or a partial nail avulsion. Generally, people tend to lean towards the chemical matrixectomy because there's a lot less cutting involved, and it is pretty effective. So the recurrence rate generally is between 1 and 3% for the chemical matrixectomy. And the wedge resection, generally the recurrence rate is around 1 to 3%. So it just depends. And so a lot of people choose the chemical matrixectomy. In that particular procedure, the toe is numbed, and that's the one where they cut down the side into the matrix itself, and they pull out that side part of the nail that they just cut away. They scrape out any remaining nail spicules underneath the skin behind the proximal nail fold where the nail matrix lives. And then they put a solution of phenol on a Q-tip and stick it in that hole for about a minute. So that helps to kill off the cells that the nail matrix creates. And then it just gets wrapped up and the healing process takes place. The healing process is actually longer for this type of procedure, around 3 weeks. And which was surprising to me because I watched both of these surgeries and it seems like the wedge resection would be a lot harder to heal from. But the wedge resection actually only has a healing time between 8 and 10 days, which is surprising. With the wedge resection, it's going to be hard to describe, but basically instead of cutting from the tip of the nail downward towards the base of the nail, you're going from behind the nail in the skin, cutting into the skin deeply and going all the way up to the edge of the nail. And then the cut has to hit the bone. So they're going deep into the meat of the toe. And then they go back to where they started the cut behind the nail and they go lateral to it. So it comes out wider where the ingrown toenail pain is. And it meets with the end of the first cut at the tip of the toenail. So it creates this sort of wedge look hole in the nail. And then they take out all the tissue. And then they have to then suture it closed so that it heals because it's a big gaping hole. So yes, the chemical matrixectomy is a lot easier on both the doctor, I believe, and the patient. So what you're seeing on her toenail is not necessarily actual nail that's growing back, but hardened skin that almost feels like a nail to her, creating a lot of pressure and pain deep in that groove underneath the edge of the nail where the nail was cut for her surgeries. If you are thinking about going in for surgery for an ingrown toenail problem and you've exhausted all the possibilities, so you've tried the bracing, you've tried, I don't know, different types of things to help relieve the pressure, the chemical matrixectomy is probably the one with the highest effectiveness. That's according to this one study I looked up. Although it does have a longer healing time, but it has less pain in that recovery stage as well. Whereas the wedge resection, the healing time is lower, but the pain is higher. But I guess for a shorter duration. It wasn't clear in the study exactly how long the pain lasted for the patients who underwent that. So that's just for your information in case you were looking into this type of surgery. You'll see with her, the more I remove, it seems like the more is uncovered. And, I keep going back and say, did I get it all? Did I get it all? Do you still feel the pain? And you can see as you watch how much hardened skin is piled up underneath the sidewall here. If you yourself have had this ingrown toenail surgery, I'd love to see in the comments if it was successful and what type of surgery you opted for. Did you have to go back for a second or a third to get it really to work, or did it work out the first time? We talked about trying the Curve Correct band that would help to reduce the pressure. So we apply it at the base of the nail where it's the most pressure, and it would hold it in that position where it's lifted out of the groove. And that way the body won't create as much hardened skin as a protection mechanism underneath the lateral border. Thanks everybody for coming by today. I hope you learned something, and I will see you next time. Have a great day.